Yes.
Hello po, good evening. Good evening all. Good evening Qatar and of course sa our very own
Evening.
Philippines. Good evening everyone around the globe. Kamusta po kayong lahat? I hope everyone's doing well. And by the way, I'm your coach Sabira who will and I'm happy to assist you virtually for tonight. Inshallah po. So to commence, let's all have a short prayer and please repeat after me. Ma'am Bansh, okay na po?
Yes po, we can start.
Alright. So let's have a prayer po. O Allah, our God, you are sovereign and there's no God worthy of worship except you. You are my Lord, creator of all that exists, and I am your slave. I have wronged myself and I have acknowledged my sins. So forgive all my sins. For no one forgives sins except you. We thank you for this time as we gathered tonight, and we ask you to protect us and grant us goodness in everything we do. Amen. Thank you po. Maraming pong salamat sa inyong lahat. And tonight, we will going to discuss the benefits of STC30. And to go on, let me introduce to you our speaker. Our speaker. She is an accreditation or accreditation focal person, a staff nurse in Primary Healthcare Corporation, and she holds or entitled as USRN, Qatar RN, and PHRN. And she's been a member of SuperLife since July 2024. Also, she is certified bionutritionist and of course a certified SuperLife speaker and a presenter. Let's welcome our very demure, very mindful, very pretty Coach Jinky Lamosad. Ma'am Jinky,
Natawa naman ako sa
hello po.
very demure. Parang it's not me to be very demure. Hi, good evening everyone.
Very demure.
Very demure. Very Parang gusto ko panagutan na very demure ako tonight. But anyway, guys, good evening everyone. I'm so honored, first of all, for being invited as speaker for today's event. And before I will start, let me just say hi to our coaches who are here tonight to support me and of course to support our guest. And also, hello kay Miss Chris at Ma'am, sorry, nauna yung slides ko. To our guest ngayong gabi. So, as Miss Samira said, we will be talking about the benefits of stem cells. That is the main point why we are here tonight. So, hindi ako I don't know if everyone speaks English or Tagalog here, pero ano, I will be using mixed language. Sakali po hindi tayo nagkakaintindihan, feel free to let me know. So, we will start with the benefits of stem cell therapy, but before that, let me explain it in a level we're in paano nagre-repair at nagre-regenerate ang ating body. So let's start with a little review of our anatomy and physiology sa human body. All right. So let's talk about stem cell and how it functions in our body. First, guys, let's have a review. What are the components of our body? So our human body is composed of a lot of cells. So usually in the basic level or the basic unit of our body is our cells. So every inch of your body right now is composed of cells. And with these cells, guys, if they will group together, they will form a tissue. What are the examples of tissue? There are different types of tissues. Depende po kung saan ang parte ng ating katawan. Like for example, we have cardiac tissues if which is responsible for the cardiac action or yung pagpapump ng ating dugo. We also have brain tissues. So each organ of our body, they have specific type of tissues which is unique on that organ because it helps them perform this job. So once this tissue groups together, guys, they will form organs. So in each organ, what are the examples of organs in our body? We have your brain, your lungs, we have your heart, we have your kidneys, your liver. Each organs, guys, if you notice, they have a specific function that is essential to sustain life. And once these organs group together, they will form the human system. So we have a lot of human system. I know you hear about them. We have your digestive system, circulatory system. We have your excretory system. So this system, they have unique functions which sums up sustain us as a human being. So what happened is as we age, since po pinanganak tayo, this system or our body is constantly developing and progressing. And of course, as we grow up, we are exposed to a lot of stress and chemicals in which we have this called, I don't know if you are very familiar with the wear and tear theory. So as we old, our cells, guys, it diminishes its function. Kasi sa sobrang gamit po natin sa katawan natin, it will lose its function. So with that, our body also has a natural way to generate or repair itself. So one of it is we have our stem cells in the body. So how stem cells work? The stem cells divide to form more cells called our daughter cells. So in other words, sa katawan po natin, the main area that produces our cells are our bone marrow. That is why if ever, I don't know if you hear about it, kung may mga pasyente po tayong may cancer, what they will do, they have bone marrow implants para po to boost the bone marrow to produce more cells. So ang mga bone marrow po natin, what happened is they release stem cells in the body which help our system in repairing. So usually our stem cells is called our mother cells because from that basic stem cell it will evolve or it will mature rather to the different types of cells in our body like your sex cells, your muscle cells, your fat cells. So it can mutate to the different types in which it depends kung ano pong kailangan ng katawan natin. So from this, it is considered the repair kit of our body. Kasi for example, let's say you have a problem sa kidney mo. Your kidney function is diminishing. Let's say you only have 60% of your cells who is functioning in your kidneys. So what happened is our body tried to compensate with that. And how it will compensate? It will try to produce stem cells to mutate and mature into kidney cells so that the function of our kidney will increase. So that is why it is considered repair kit. Then if you notice, as I've mentioned, we have this, it is also supported by science, your wear and tear theory. Look at the demonstration po. When we are born, look at the baby. The stars represent how many stem cells do we have in our body. So when we are born, we have 100% of stem cells present in our body. Why? Kasi po, the babies are constantly developing. So lahat ng stem cells nila, it is still mutating and maturing so that it will become a full functioning organ. But as we age, it gradually diminishes because ginagamit na po natin ang katawan natin. Aside from that, we are exposed with a lot of let's say stress, toxic substances that may also what helps or adds up why our stem cells or the percentage of our stem cells diminishes. So if you can see po from being a baby, we have 100% of our stem cells. By 18 years old, according to study, it is reduced to 40%. And then by the age of 30 years old, 25%. And look at that. Once you will be 60 and above, you will be the stem cells or the remaining stem cells in our body is 5%. That is why when you become 60 years old, guys, they are very prone to a lot of lahat ng sakit lumalabas na. Kahit nga 30 years old right now, we experience a lot of diseases kasi we don't have enough repair kits sa katawan natin. In other words, for example, if may mga organ tayong nasisira na or their function is diminishing or hindi na or yeah, nasisira na dahil nga sa, let's say, unhealthy lifestyle natin, we don't have enough reparative cells to produce or to compensate with that. Compensate means para ma-solve yung issue ng diminishing function ng ating organs. So that is why it's very essential that we need to keep our cells healthy. Now, as we age, as I've mentioned, we have decreasing stem cells activity. So why the stem cell activity is decreasing? We have a lot of factors that is contributing to that. So we have this free exposure to radicals. I just want to share something, no? Since nandito tayo. I have an interview, I think months ago, sabi niya, Miss Jinky, ang tagal mo ng OFW po, di ba? So, sige, ilang taon ka na po bang OFW? So, sabi ko siguro at this year, 10 years na akong OFW. Tapos sabi niya sa akin, Ma'am, ano pong naipon niyo? So, if I will ask you, ano bang naipon niyo sa buhay niyo? So, of course, aside from, let's say, siguro ang dami niyo nang naipon. Yung iba sa amin dito, mga coaches namin, ang dami ng properties. But, the very obvious reason, the moment you look at someone, guys, look at your physical aspect. If you will compare yourself 5 years ago, I don't know if you have a picture of yourself 5 years ago, and compare it right now, there's a huge change, especially sa katawan natin. I think lahat tayo may Facebook, right? Facebook, every year, every day, meron siyang memory. Na-try niyo ba yon? Yung, I don't know, may function siya na memory. Or ito nagre-reflect yung 5 years ago, who are you? 5 years ago, di ba? Nakikita mo na lang, ang laki ng binagbago mo. Parang halos hindi mo na makilala yung sarili mo 5 years ago until now. So why is that? Because we have free exposure to different radicals. And of course, we have stresses in life. So sabi ko sa nag-interview sa akin, alam mo, naipon ko lang. Siguro very obvious, taba at eye bags dahil sa pagtatrabaho. So, I hope naman, I'm planning to change it into about, I'm planning to change to be better. Hopefully, hindi pa din naman huli ang lahat. So what are the free radicals that you can find around an area? We have your radiation. Radiation, guys, hindi yan sa x-ray lang nakukuha. I think very obvious, pag pupunta kayong hospital, may x-ray department, you can see this warning sign, radiation hazard. It doesn't mean and sa hospital mo lang makukuha ang radiation. Radiation is everywhere. You can find it in your cell phone. Your cell phone emits radioactive waves. Okay, we can find it in every gadgets, computers, PC. So we have free exposure to that radicals. And then we also have lack of sleep. Sino kaya sa atin dito yung may 8 hours of sleep? Anyone? May 8 hours, taas nga ng kamay. Sino may 8 hours of sleep na dito? I-reward natin. Because I highly doubt, right now, guys, the normal sleep na we have, even if you try your best to be healthy, okay? And even if you try your best na to live healthy, I think the minimum siguro 5 to 6 hours. Why? We are bombarded with a lot of responsibilities. Sa example, pag nanay ka, of course, especially if you are a working mom, inaasikaso mo mga anak mo, inaasikaso mo asawa mo, then you need to prepare for work, right? And how much hours left para lang matulog. And sometimes you need to wake up kasi luluto ka pa, magpe-prepare for work. And then we tried our best to manage our time, but then in the reality, you need to work to live. So what happened? Kailangan mong gumising at magbanat ng buto. That is why most of us lack of sleep. Aside from that, if you are overstressed, if ikaw yung taong mahilig mag-overthink, you cannot sleep well when your brain is actively thinking, especially if ang dami mo iniisip na problema. Okay? So, that is why lahat tayo, kahit gustuhin mo mang matulog, if ang dami mo inaalala sa buhay, when you keep on thinking yung utang mo, anong gagawin mo bukas, magbi-birthday na ako, may tuition fee pa, yung mga ganon, you cannot sleep. Then, of course, lack of physical activity. Sometimes, I think every year naman, since it's February, I think last month, January, lahat tayo nag-pray or lahat tayo nag-write ng New Year's resolution to increase our physical activity. But it's very impossible. Why? Human as we are, the moment we have free time, anong gagawin nyo? Of course, you just want to lay down and then umupo, manood ng Netflix or mag-scan if nakakaupo pa kayo, if hindi kayo if you don't have, kung hindi kayo sobrang busy. But because ang dami nating ginagawa sa buhay, we don't have or we don't find time to have physical activity. Then of course guys, with stress, especially lahat tayo dito nasa mid-adult and young adult stage, one of our coping mechanisms if we are stressed is unhealthy habits. Example, if you are stressed, you are craving for unhealthy eating, unhealthy foods. It's very, it's very common. Kung nasi-stress ka, gusto mong kumain ng burger ng Jollibee, gusto mong kumain ng fried chicken, feel mo, reward mo to. And then, you feel that it's valid to eat that meal kasi pinagtrabahuan mo. Napagod ka, right? And then also, guys, some of us resort to alcohol and smoking. And of course, as I've mentioned, stress will not, hindi tayo, I think no one is completely stress-free. Siguro kahit mayaman ka or sobrang yaman mo, you are completely stress-free. So with all these factors evolving and surrounding us, it really helps ourselves to be unhealthy. So how free radicals harms our body. So usually in this presentation, if you can see, this is our normal cell. Ito pong red dots na to, these are our free radicals. So once our normal cell is exposed to free radicals, what will happen? It attacks our cells. And if you can see, once the free radicals is attached to our cells, what happened? It slowly shrinks down, and then it becomes the cells will have oxidative stress. So, anong problema pag may oxidative stress ang ating mga cells? Guys, the functional capacity of our cells will be diminished. In other words, the functionality hindi na siya makakapagtrabaho kung ano dapat niyang gawin because nasisira na siya. Slowly, your cells are dying inside. Now, what is the common symptoms of oxidative stress? Look at your faces. I hope you cannot see it. Guys, pag if you can see, fine wrinkles, aged skin, yung mga ganon, na parang nalulosyang ka na, that's one sign. Now you have a lot of oxidative stress. So that is why, if you notice, guys, if you compare a woman in her 40s, you can see different types of women. Merong 40s na, pero looking 20s pa din, ang bata-bata baby face. Merong 40s na, pero akala mo senior citizen na because their skin is very wrinkled or tumatanda ng, and we call it advanced aging. And it's because of the oxidative stress that we have. So since since as I've mentioned, now once we have oxidative cells, or if our cells are full with these oxidative free radicals, it will result to some of these diseases. So very common, we have heart disease. Example of heart disease, guys, we have hypertension. Sino na bang may mga maintenance dito? So hopefully hindi naman lahat. So nowadays ang ang babata na ng mga nagbe-maintenance. So in my work, yung I'm so shocked, nasa 20s meron ng maintenance para BP. Another common problem, guys, cancer. Okay? Cancer, I know a lot of people who have cancer. In my family line, halos tito ko, lola ko may cancer. Okay? Chronic respiratory diseases, we have obesity and diabetes as well. I do hope that we maintain this in relation to obesity. Sino po ba dito na everyday nagtitimbang? Meron po ba? Alam niyo ba kung ano kayo? Kung obese, overweight, underweight. So it's one way of self-awareness. So right now, guys, a lot of people are obese, even the younger age. We also have CKD or chronic kidney diseases. And of course, your neurological or neurodegenerative disease. Example of neurological, guys, problems, very common is your stroke. And of course, your infectious disease. So because our cells lose its functional capacity, ang easy pong masira ng ating mga organs, which resulted to this type of diseases. Now, if you will ask me, Miss Jinky, saan po ba makukuha ang stem cells? Kasi parang feel ko slowly degenerating na yung body natin. Well, we have a lot of sources, okay? The first source, guys, is our human stem cells. So usually, sa sarili mo, you have your own bone marrow that produces that stem cells. Now, sakali mang you are so unhealthy para kumuha ng bone marrow sa sarili mo, what will happen? You can get from another person. That is why we have bone marrow donors. Particularly, guys, it's very common sa mga cancer patients natin. The doctor will suggest to have bone marrow injections to improve the stem cell production. So that is one of the natural cause. It comes from our body. Okay? The second cause, because of course, not all naman pwedeng maging bone marrow donor because it needs compatibility. All right? So, through the advancement of technology, what happened? We can now get stem cells from animals as well. Ano pong problema sa animal stem cell? Of course, guys, as I've mentioned, when we try to inject something that comes outside our body will detect it as a foreign object. That is why every injections or implants or even transplants that comes out from outside or galing po sa labas, our body, it needs to be compatible with our body. Because if it's not compatible, our own body will detect it as an enemy. At anong gagawin nila? The moment it enters your body, it will attack it. That is why a huge issue for animal stem cell is your rejection. Because since hindi tayo masyadong compatible sa hayop, kasi nga tao po tayo, a huge percentage of bone marrow transplant from animals are being rejected. Although there are cases na successful naman, but overall, mas mataas pa din yung rejection rate from animal stem cell. And the last source that is, part of a great science discovery, shall I say, is our stem cells that comes from our plants. So, even po ako, I studied nursing. During my time in the academy, I never thought na may plant stem cell. So, when I tried to read, yes, my plant stem cells po ang may stem cells po ang mga halaman natin. Of course, this one is now, it's due to the market, but it's slowly progressing because it gains popularity. So, this is where our product is inspired from plant stem cells. So with this, guys, I want to introduce our product, which is an oral plant-based stem cells. So this is our STC30 from SuperLife. So what is this, guys? This is a stem cell booster or stimulant in which it comes from different plants. So this is the star of our show tonight, our STC30. So we are getting or harvesting stem cells coming from plants. Now, if you will ask me, is there an advantage if galing po sa stem cell ng plants, ang stem cell na nilulunok or ini-ingest natin? I should say, yes, it's a big yes. Why? The rejection rate for plant stem cell is less. Okay? And since this is a booster or a stimulant, hindi siya nade-detect as foreign body sa katawan natin. The second is, yung plant stem cells, guys, it's very safe compared to animal stem cells. So, the goal for us here is to introduce this product in our body so that we can produce the percentage of stem cells in our body. So, as a recap, as I've mentioned, as we age, nagdi-decrease po ang ating stem cells. So, we try to help our body by what? Stimulating it to produce more or boosting it to produce more stem cells in our body. So, with this process, guys, we try to reverse biological aging. Why are we going to try to reverse biological aging? Is it possible? Yes, it's very possible because as we increase stem cells inside our body, what happened? Your repair kit also increases. So, siguro maraming cells na ang nasisira sa katawan nyo. If we also combat the reparative or if we increase the repairing capacity of our body as well, then it's very possible that we reverse biological aging. Kasi we have stem cells now to correct those malfunctions or malfunctions or defect. So the goal of this stem cell therapy is holistic approach, holistic oral stem cell therapy. Why holistic? Because your stem cells is your mother cells. It is not selective. Hindi po siya yung parang pag lulunok ka sa gamot, it only addresses your heart. To understand it better, so sa mga nagtitake ng gamot ngayon, if you have diseases, example, hypertension, diabetes, let's say mataas yung cholesterol, doctors order medicine. And that medicine, guys, it is not holistic. When we say holistic, lahat po ng parte ng ating katawan will benefit from it. For example, I have let's say may amlodipine ako. I'm not sure if you're familiar with amlodipine or captopril. Isa po yan sa mga maintenance para hypertension. That only addresses mataas na BP mo or your hypertension. But if may diabetes ka then, what happened? Is it addressing or solving your DM problems? The answer is no. So, anong gagawin mo sa DM mo? The doctor will also write another medicine which is for your diabetes. Kaya minsan, kung may hypertension at diabetes ka, nagtitake ka na ng isang maintenance sa BP, isa pa ding maintenance para sa sugar. So, ilang tinitake mo? Dalawa. Paano po if may cholesterol ka pa? Paano po if may sira yung atay mo? So, what happened? Paano po if low yung immune system nyo? Kailangan nyo pang mag-vitamin. So, ilang gamot na yon? It becomes 5 or more. That is why ang mga nagkakasakit, they have a lot of things to take kasi each medicine only has a specific function. However, when we say holistic, guys, isang gamot or isang product lang, hindi ko sinasabing solve agad, but it targets everything because stem cell or stem cell therapy helps regenerates new cells in our body. If you remember, I introduced that stem cell is our mother cells. For example, may sira yung kidney function mo. Your kidney is only functioning 60%. So what happened to stem cells? Your bone marrow produces stem cell. Stem cells will try to mature to become kidney cells. That is why it can regenerate new cells. It could also rejuvenate aged cells because it can replace those. For example, since it could mature into this type of cells, it could also combat aged functioning of your cells. So it rejuvenates our aged cells. It can also repairs damaged cells because of these functional capacity. Also, guys, it also helps restore sick cells. So, it becomes holistic kasi it detects kung anong problema po ng katawan nyo. For example, malabo yung mata nyo. So, the stem cell or body So, for example, malabo na yung mata nyo. So, what happened? Your body detects that the functioning capacity of your eye cells diminishes. So, when they produce bone marrow, like for example, when your body produces stem cells, so it will travel to your eyes and try to mature into what? Into eye cells so that it can restore the functionality of your eyes. But let me clear, guys, I'm not saying that this is a medicine. Hindi po to gamot, ha? So for example, kung may mga tinitake kayong gamot right now, I'm not suggesting na you stop it and drink STC30. What I'm trying to do is it's a supportive mechanism because it helps repair our body. And also, guys, it replaces dead cells as well. And lastly, it can detoxifies the body because the first thing that STC do the moment you will take them, it will clean our body first. So once it is clean and free from free radicals, now it will start its repairing function, which is to detect if may mga malfunctioning cells po sa katawan natin, and then it will try to repair it. So far, okay naman po. If I'm so fast, please
Okay naman
okay
po.
naman po.
Very clear.
Naiintindihan lang. Baka kasi super medical yung explanation ko. At least, if you have questions or clarification, you can always stop me anytime. Okay? Thank you. So let's move on. So I want to introduce, I already introduced STC30. So let me just give you a quick background. So STC30 is produced by the SuperLife company. So our main company po is nasa Malaysia, but we gather most of our ingredients in Switzerland. So this is our company. This is the company's CEO. The founder and the CEO is Mr. Late Tikian, and our co-founder is Mr. Paul Nair. So this is our CFO. So ito po yung nagpasimula ng STC. And then, as I've mentioned, we also have the one that process our product is the SuperLife company, which is in Malaysia. But our sources or yung mga ingredients pa ng STC30 namin is coming from New Zealand. It is headed by Mybel Biochemistry Group, which is led by Dr. Fred Zuli, which is he is the managing director of Mybel Biochemistry. So ang nangyayari po, the ingredients for our STC30 is coming from Switzerland, from Mybel Biochemistry. They send it to Malaysia to be processed as STC30 or our stem cell therapy. So during the process, I will just give you a quick background how STC30 is produced. We utilizes the phytotech technology. So phytocell tech is the name of a new biotechnology that researchers from Mybel Biochemistry have used successfully to generate and cultivate plant stem cells. So yung stem cells po, if you can see, it's a hindi po siya nakikita through our naked eyes. It's in microscopic level. So in order to harvest it, we use phytocell technology. So with this technology, the growth of callus cells or wound tissue in selected plant tissue is induced under special conditions. So ito po yung method na ginagamit namin to harvest the ingredients for our STC30. Now, what are the ingredients? So, yung STC30 po namin, it's not coming from one fruit only. In order to attain its holistic effect, it is coming from 9 bioactive ingredients. So, nakikita niyo po ngayon ang different prutas or ingredients ng ating STC30. So let me introduce to you to the different 9 bio-ingredients of our STC30 just to give you an idea what are the benefits of the product since it is extracted from these types of fruits. The first one, guys, is our Malus domestica. Malus domestica is a type of apple. So parang isa siyang variety of apple. With this, guys, with Malus domestica, the function of this, it activates 80% of human stem cells and it combats biological aging and anti-wrinkle effects. It also promotes cell regeneration, collagen production, and increases synthesis and repair damaged cells and tissues. So what happened? Alam niyo naman ang daming apple, no? So if you will go to the supermarket, guys, ang daming apple. Okay, may Gala, may Royal, may Fuji apples. So we don't get a certain apple only. It comes or they choose Malus domestica because they experimented over 100 types of apples in Switzerland. So ang nakita po nila sa Malus domestica, when they try to cut the apple, if you notice, kung magsa-slice po tayo ng apple, it becomes brownish after a few minutes or hours because para siyang nagra-rot, diba? So when they try the different types or variety of apples, so what happened with Malus domestica, when they cut Malus domestica, hindi po siya nagra-rot or hindi siya nagtuturn into brownish discoloration, which means that they have a good regenerating capacity sa cells. So with this, they try to investigate more, and then they decided to harvest the apple stem cell of Malus domestica. And with this, guys, that is why it promotes cell regeneration as well and collagen production. So the healing properties of these Malus domestica, it has prebiotics, it also have probiotics and antibiotics. So this is only one of the ingredients. Pangalawa po is we have this is what I've mentioned. They tested different types of apple and look at Malus domestica. The rest of the apples is rotting very fast. However, Malus domestica retains its freshness. Then the second type of fruit po na contain ng STC natin is your grape stem cell. So it comes from grapes. Grapes is rich in collagen for skin, which is good for skin elasticity. So a very common problem po natin right now is our skin, because your skin reflects your physical outlook, 'di ba? Lahat ng ang daming tao po ang nag-i-invest sa skincare products because they wanted to look young. And then because of our constant exposure to UV radiation, ang bilis nating magka-wrinkle at magkasagi skin. So grape stem cell po is very rich in collagen, which enhances our skin elasticity. It also have anti-wrinkle effect, which fights photoaging, and it has extremely high in anthocyanin, then more vitamin A, vitamin C, and E. So just a little bit background. I just want to share ano pong function ng vitamin A sa katawan natin. So usually vitamin A is good for our eyes. It enhances our eye function. And then for vitamin C, I think everyone is aware, it boosts our immunity. And of course, vitamin E, it's also good for our skin. That is why it also have anti-wrinkling effect. Okay? Then it is also essential for the vital and healthy looking for us to have healthy looking skin, and it also benefits memory and our overall brain health. Now let's go to the third components of our product. We have your cantaloupe. Guys, this is not your ordinary cantaloupe. This is your glycidin cantaloupe. Okay. This cantaloupe prevents DNA damage, which induced by oxidative stress. So if you notice, if you wonder what is our DNA, I think DNA, guys, is the blueprint of our body. So in order for cells to replicate, they should have our DNA copy. They should also protect our DNA. So if your DNA is damaged through oxidative stress, these cantaloupe or your glycidin will help in protecting our DNA so that it will not be damaged immediately. It also acts as defense system of the body and strengthen our cardiovascular system, as well as promote production of body's own antioxidant. So it has protective property. So in other words, parang si cantaloupe po, it shields our cells so that it will not be easily damaged by oxidative stress. And then we have your black currant, which helps in improving our blood flow. It is also good in the management of our blood clots or blood clotting. It also lower our cholesterol, our blood pressure, decreased risk of heart attacks, and it is also good for type 1 and type 2 diabetes. So usually, guys, if you have DM or if you have diabetes, just to share it to you in a medical coming from a medical perspective, type 1 and type 2 diabetes, they are so prone of blood clots. That is why most of our diabetic patients, they have stroke or even cardiac heart attack because of blood clots. Why are they very prone to have blood clots? Because the moment you have DM, as your blood has a lot of sugar in it, we call it your blood sugar. Yan yung chine-check niyo during RBS. When your blood sugar increases, guys, it's like when you put a lot of sugar in a water, your blood becomes sticky. The moment your blood becomes sticky, the blood flow also diminishes or it becomes sluggish. So meaning as your blood circulates in a slower motion. Since your blood is circulating very slow, what happened? It gives time to your platelet to clots. So if you notice, your blood has a lot of components. You have your red blood cells, your white blood cells, and your platelets. Your platelets is our clotting factors. So what happened to our platelets? If magkakasugat po tayo, they goes to the site ng sugat at they try to stop the bleeding. So with type 2, guys, when your blood is circulating very slow, these platelets have time to clot. That is why diabetes are very prone to blood clots. Then black currant is also rich in vitamin C, E, B1, B5, and B6. If you wonder, guys, what is the function of B1, B5, and B6, this is very good for our nerve endings. If you are suffering right now, for example, numbness sa legs or numbness sa foot or yung parang kinukuryente ka sa paa, that is because our nerve endings or our nerves is unhealthy. So usually doctors will order B complex or ask you to take vitamin B so that to protect or improve the health of your nerves. Then also black currant support our kidney function. Next po is your camu-camu berry. Camu-camu berry is a type of berry. So what happened? With camu-camu berry guys, it has a high vitamin content. It also contains powerful antioxidants. It helps us fight inflammation. It can also reduce weight, improve our blood sugar levels, and antimicrobial properties of the body, and improves your blood pressure. We also have your bilberry or your Vaccinium myrtillus. Your bilberry addresses or helps our liver. It protects our liver from liver damage. It also supports kidney function. It helps improve skin problems and improve blood peripheral tissues. Okay? It also helps us, guys, in preventing cancer and eye disorders. And it helps us to manage urinary tract infection in our body. Next po is another type of berries, which is sea buckthorn. So this is how it looks like. So this time of berries po is very rich in many nutrients as well. It helps protect our skin. It also promote heart health and reduce blood sugar levels in our body. Then with that, it also boosts our immune system, support liver health. They also have or possess anti-cancer effects. It also improves the appearance of our hair, relieve the symptoms of menopause, treat dry eyes, especially guys if you constantly experience red eyes or niluluha yung mata nyo. That is a very classic sign of having dry eyes, and it could also help in improving our digestion. Now, let's go to the last two components of our product. We have your prickly pear cactus seeds. So yes, tama po kayo. It comes from cactus. The name of the fruit is your prickly pear cactus. So with these guys, it helps in promoting or treating diabetes, also for controlling high cholesterol and obesity in our body. It also prevents liver injuries due to excessive consumption of alcohol and hangover, and it also touted for its antiviral effects. When we say antiviral, it fights against your antiviral infection. What are the common viral infections? It's very viral infection that we have. Guys, your flu is caused by virus. We also have your chickenpox, your measles. These are viral infections. So these prickly pear cactus fights against or it has antiviral properties. And then it also helps in anti-inflammatory properties and prevents cell damage. And of course, last but not the least, from our ingredients, we have your golden kiwi seeds. Yes, meron po tayong pangatlong type ng kiwi, which is what you call your golden kiwi. So this golden kiwi, what does it do? It promotes healthy skin and hair in our body. It supports digestive health and immune system. It promotes good digestion. support healthy weight loss. It also slows down aging and help prevent chronic disease. And of course, it benefits moms and babies as well. So imagine from the benefits of each of these fruit, all those nine, we get each of its properties to produce our plant-based stem cell. So presenting our stem cell product, which is STC30. We call it as miracle powder in a sachet, and it is formulated through nanotech formulation. When we say nanotech po, it pinupulbo po siya so that the product will be absorbed faster in our body. So we call it miracle powder in a way that it possesses, as I mentioned, your holistic way in repairing our body. Because if you mention, as I've mentioned, it is based from these nine ingredients, and nakita niyo naman ang benefits ng each of the fruits. Imagine we contain it in one product. So if you wonder, Miss Jinky, how to use that? So our STC30 po is a powdered product in a sachet. So we placed it or we use it through sublingual ingestion. So what is sublingual po? We open the sachet at binubudbord o tinataktak po under our mouth. So sublingual means under po the tongue. Why po under the tongue? Because if you notice, guys, if you lift your tongue, makikita no, you can see one big artery there. We call it your sublingual artery. So this sublingual artery, guys, the moment the powder melts in our mouth, immediately it goes to our bloodstream for faster effect. That is why it directs to cells, tissues, and bloodstream. Iko-compare nyo po siya sa gamot. For example, if you take Panadol, anong mangyayari or yung mga medicines nyo? It goes to your mouth, down to your esophagus, to the stomach, and then meron pang small intestine before it will be absorbed by our body. However, through sublingual route, what happened? The moment it melts, it directly goes to our body in less than 2 to 3 minutes. So the recommended time to take this, our product, is 1 hour before breakfast or after meals. So the moment po na gigising kayo, wala pa pong mumog, diretso po ilagay sa ilalim po ng ating dila. Also guys, sublingual route is also, it has its own advantage. Why? Our medicine or our product does not pass our stomach, and our stomach has hydrochloric acid. So sometimes our hydrochloric acid, it has properties because acid is very corrosive. It damages some of the components of our medicines or vitamins. That is why through sublingual route, the medicine is not exposed to hydrochloric acid. So immediately po, it is an assurance that directly po, you can attain its effect. So as I mentioned, our product po is inspired by nature and it is cultivated and realized by science. So the product po itself, it is not, hindi po siya ginawa for a specific disease, but because of some people who uses it, they found out that it cures this type of diseases. Hindi ko na po siya iisa-isahin kasi ang dami-dami po. It's not us who discover it, it's our patients who informed us of its miracle effect. So according to them, the moment they start using the product, all these type of problems that they have is being corrected. So ito po, ang dami-dami. I don't want to read it individually. So if you are curious about the legitimacy of the product, let me present to you our certificates. Legal po ang STC. You can search it. We also have insurances that ensures that ensures our user that we held responsibility if ever man may mangyari masama sa users namin because of ingestion of our products. It also halal certified. And of course, we have license to function or produce the product in the and introduce it to the market. Our company is operating or operational in more than 42 countries. In Middle East, guys, we have We are currently functioning in Dubai, in UAE, and in Qatar. Then these are the countries that we have STC, who is operational in distributing STC products po. So these are our leaders coming from different world. And of course, I'm so proud to introduce our Qatar team leaders headed by Sir Dennis and Ma'am Vange. So ito po yun sila, the power couple ng Qatar. So just to give you a quick life-changing experience, it comes po sa mga users namin dito from Qatar, just to ensure or just to prove how the product is very effective. So let me introduce to you one of our users who has sciatica. So if you are very familiar with sciatica, it affects your nerves in the back, and if isa po to sa pinakamasakit na, or it's one of the problems that causes pain to our patients. So usually hindi sila nakakatayo and they cannot function the moment they have sciatica problem. So from our user, the moment she engulfed STC, it improves her sciatica. So 8 months na siyang gumagamit, or 8 months na siyang nagsasuffer, but look at her right now. She slowly resume her daily activities kasi she cannot feel or barely feel the pain due to its sciatic problem. We also have another patient who is cured. Look at her skin. He is suffering from eczema or tinnitus. So if you can see closely kung ano nangyari sa kamay niya or sa skin niya, nagbabakpak po. We call it eczema. After using STC30, compared how smooth his skin is, it's because of the reparative function of our product. We also have another living legend, Sir Marlon. So we witnessed the journey of Sir Marlon the moment he started using STC until now, and look at, tingnan niyo po ang improvement sa BP niya. From having a BP of 183/115, usually this is a very dangerous blood pressure. It triggers stroke. The normal blood pressure of our human body is only 120/90. At look at yung blood pressure ni Sir Marlon before. It's 183/115. It could trigger stroke, and right now, because of the usage of STC, tingnan niyo po, bumababa na siya, and he's maintaining it at 143/93. So it goes to prove how effective the product is. And of course, the man that discovers STC in Qatar. So he is suffering from psoriasis, and you can see, I think this picture speaks for itself. From before using the STC, ganito po nangyari sa skin niya. And look at how his skin looks like right now. It's clear, it's lesion-free, and of course, guys, the patient is not also suffering because he is relieved from psoriasis as well. From these four, there's a lot more of our users who can attest the effectivity of the product. I will only be sharing these right now. If you are very curious to ask more, we have our leaders right now and coaches. You can ask more about the product. Then I just want to remind you guys that health is a relationship between you and your body. Katawan po natin ang ating bukunan sa araw-araw. So please be vigilant in taking care of yourself. Especially listen to your body. I know right now you are aware of the different functions and problems of your body. Let's face the reality. We are not getting any younger. Okay? So as early as now po, let's try to be helpful, and let's try to protect and regenerate or help our body. Health is everything. Of course, kapag nagkasakit ka, you can never function. So health is considered wealth. Any question po so far? We come to the end of the presentation. Especially po sa aming guest, Ma'am Chris And Ma'am Marianita, any questions? Sa mga audience, any questions po?
Ayan.
Ma'am Vange,
Thank you
any
so
questions?
much, Coach Jinky. Very, very, alam mo yun, nakakatuwang makinig kasi kakaiba yung approach dahil mas marami tayong related to scientific, no? Punto per punto, sabi nga ni Coach Joel kanina. So, thank you so much, Coach Jinky. And kung may mga question po tayo, si Mami Marianita, baka may tanong po kayo. At si ating pong Ma'am Chris Mina, baka may question po doon sa presentation ni Coach Jinky. Feel free po.
Any questions? Sorry, nag-extend pala ako. It's already 8:10.
No, it's okay. Maganda
Any
nga. Ang
questions
dami namin
po?
natutunan. And I'm sure sila din. Madami rin po silang natutunan ngayong presentation natin, no, tonight. And thank you so much again. And any more questions? Ayan, ikaw Sabira, may question ka ba kay Coach Jinky?
Oo nga, it's your time
So
to.
far, wala naman po. It's very, no, clear na po. I mean, it's very clear. And there's more, surely, sa mga coaches mo natin.
Thank you
It's
po.
indeed
I hope you learned something tonight. And thank you for the opportunity in sharing.
Coach Dinky,
Ay, Sir Marlon, kumusta po? Long time.
may nagpapatanong po, how to be
Ah,
with you daw, how to be with you.
how to be you? Bakit? Nakakaano naman. Ano, how to be May, very demure.